Hello and welcome. I'm Dr. Frank Liberty. Welcome to another Personal Injury Hidden Gems vodcast. Today is an attorney education presentation because many attorneys, and including insurance companies actually, are unaware of a new injury called AOMSI. The injury itself isn't new, but its valuation is new. It's one of the highest rated injuries, and it's seen in low-speed collisions, but it's overlooked 65% of the time. So when you find this injury, it's important that you explain it thoroughly so both the insurance company and adjuster and the attorney understand it. This presentation is the education presentation for attorneys so that they can thoroughly understand the injury. It also includes statements of undisputed facts, memorandum of points, declarations, and authorities so that they can have language to put in their demand. It includes exhibits, including an animated exhibit showing the injury. And I want to get started because this is a rather serious education presentation for our attorneys because more than half of their clients have this injury. In fact, while research says 65% of people in low speeds have the injury, we find it's even higher. It's like 80% because people in injuries that go to doctors are presenting with this injury. And it's only been recent that we've had a tool to diagnose it because it's not visible to the human eye. With half of almost all patients and clients having this injury, it's important to understand it, but even more important, to be able to document it and represent it so that we get the full valuation. And I'll explain what that valuation is and what that set-aside case settlement reserve is according to authorities. So let's get started with the presentation. I am Dr. Frank Liberty. Thank you for being here. So this is our animated exhibit for use with patients that have been diagnosed with AOMSI, alteration of motion segment integrity, and how to present this to attorneys so that they can include it in their demands. Those of you who have Zeus claim, you understand that Zeus was designed to counter Colossus. On the medical side, Zeus claim can make 600 medical decisions and determinations to match the same determination that the insurer's softwares use in bodily injury claims. And if you go to the homepage, you'll see the Zeus demand walkthrough. The Zeus demand version is for attorneys to use because it's going to allow them to exchange complex medical data and interface into the insurer's softwares, input added valuation to the claim. So the Zeus demand walkthrough has been highly regarded as a demand template, but it contains 24 sections, which is required to match all of the value drivers that Colossus will assign valuation for. So there is the Zeus program to help us further in documentation and representation. This is our book, which we want you to present to the attorneys when you meet with them, the $66,000 neck injury and how not to be misdiagnosed. And it's been the supervisors at insurance companies who have revealed that all insurance companies have set aside $66,000 for this particular injury. One supervisor said they have set aside only $60,000. And I am not the author of that information, but I am reporting it to you. So it's important to give that book to the attorneys. Now, in that book is the table formatting. In that book is a bunch of language that the attorneys can include in their demand. That language has been contributed by other plaintiff attorneys who have had success. And it's like a language library. And it's comprised of statements of undisputed facts and memorandum of points with declarations and authorities. So make sure when you make the presentation to the attorneys, or make sure the attorneys have a copy of this as well. And so just for a moment, I want to talk about serious threshold injuries. Right now, we don't have time for me to define that according to insurance law, but I can tell you AOMSI injury is what's included in a serious injury threshold. So I want to take a moment today on this vodcast. Here are the threshold injuries. AOMSI, alteration of motion segment integrity. That is a torn ligament, but it's torn to such a degree that it causes instability of the spine. It can happen in cervical or lumbar, and it is permanent. It is the second highest rated injury in a low-speed collision, and it's rated the same as amputation of a foot It's rated the same as fusion of two spinal vertebrae. The next is the uncinate process fracture. That's for another vodcast, and that's when the upward lateral projection of one of the vertebrae is fractured, which happens during side lashes and oblique lashes when the car is struck from the side, or when it spins, or when the head or neck are turned more than 30 degrees during impact. We have another vodcast for our threshold injuries on mild traumatic brain injuries. There are 4 types of concussions and 1 cerebral contusion, and we're not going to address the more diffuse axonal injuries because they're rare. Cervical chain ganglion is one of my favorite topics. There are about 172 symptoms that occur from that. It's a very serious injury, and it is going to be a concomitant injury when you have AOMSI, so you probably want to tune into that vodcast at one point. 30% of all people have vertebral basilar insufficiency from extension and rotation of the head during automobile accidents. That's a very serious injury, contributing also to headaches and mild traumatic brain injuries. And then we have auto-related post-traumatic stress syndromes and post-traumatic stress disorders. And the number 1 cause of PTSD today are auto accidents, no longer Vietnam Wars. Muscles undergo damage and they show up on MRI now. Many people are unaware of it. I want to show you how to identify muscle tissue morphology, who's a candidate, how long it takes to get it, what leads up to it. But muscle tissues actually break down and damage, and that's one of our vodcasts. Chronic pain and the G pain and the neuropathic pains are something we're moving into now, especially if people suffer after 3 months. Facets are going to be involved when there is AOMSI, and discs are going to be involved when there is AOMSI. So we want to present topics on those. Those are threshold injuries. Many people do not measure the canal size, but stenosis occurs. It's actually, the size of the canal is determined from birth. But if you have a narrowed canal, it's going to change the prognosis and injury factors. So it's one of the thresholds. And so let's talk about AOMSI. What causes AOMSI? And the answer is, according to the AMA, severe trauma. What is AOMSI? Why is it overlooked? How will it build the bodily injury claim? Well, on the first column, we see that it's ligament tear, but it must be greater than 3.5 millimeters, and it's induced by trauma. Now, you can't see it with the naked eye. Hang on, I'm going to show you how you can detect it using a new diagnostic radiographic mensuration analysis procedure, which, by the way, is covered by insurance. The second column tells us this is an objective medical finding. It is based not on opinion, but mathematic modeling. The third column tells you it represents a 25% whole body impairment. In our fourth column, we see that it has the same whole person impairment rating as an amputation of a foot. And in our last column, we see it's as severe as 2 vertebrae requiring spinal fusion. What is spine instability? What can the doctor do about it? How can the lawyer represent it? Well, spinal instability from alteration of motion segment integrity occurs when the elastic strength of the ligament stretches to such an extent that it cannot return to its original shape. And that happens because there's internal disruption or tearing of the ligament tissue. AOMSI is a loss of the functional stability between 2 adjacent vertebrae, and it causes instability of the spine. When it was first diagnosed, it was back in the 3rd edition AMA guides. And in that 3rd edition AMA guides, it didn't have a very high rating. It was not understood, but it has survived 3rd, 4th, 5th, 6th edition guides. And today they understand because there's new equipment, radiographic software that can see it, whereas before we could not see it. The initial term for this injury was angular motion and translation of adjacent vertebrae traumatically induced. In other words, the spine becomes unstable. So as I said, it was introduced in the 80s. It was in a category called specific disorders of the spine. It is still in that category today, but it went from having a low valuation to now what's sorted by ex-insurance supervisors, and it's all over the medical world. This contains a set-aside case settlement valuation, allegedly, of $66,000. The key is today's presentation will show you how to get close to that settlement valuation. With a loss of functional stability, we must understand during a sudden impact, the vertebrae will suddenly accelerate or decelerate within 10 milliseconds. Now, it is that suddenness that overcomes the elastic strength of the ligament because it takes the nervous system 350 milliseconds to respond. So this occurs before we have a chance to respond. And as the ligament yields, if it stretches greater than 3.5 millimeters, it is going to reach a physiologic extent where it cannot return to its original shape. This is due to internal disruption, a tearing of the ligament, followed by complete structural or functional failure of that ligament as seen in spinal disorders. So cervical instability of the cervical spine occurs when the vertebrae displace from their anatomical position and when they override the discs, which is why this also usually accompanies a disc injury. And subluxated vertebrae. You can see how that star shows a picture of how a vertebrae gets knocked out of position, defined as the inability of the spine under physiologic loads to maintain its normal pattern of displacement so that there is no neurological irritation or damage, and there is no development of deformity and no incapacitating pain. Well, that is exactly what happens with AOMSI. It disrupts the normal pattern of displacement, causing neurological irritation, damage, development of deformities, and incapacitating pain. That just gives you a good visual of a hand drawing showing how translation is defined as motion at the level in question. So you see that on the right, one vertebrae has moved forward or translated more than 3.5 millimeters. That constitutes an AOMSI, alteration of motion segment integrity, tearing of the ligament. There's another picture for your visual acuity, showing what happens, how the vertebrae moves out of position in the column, either in the neck or low back. And that is a tremendous instability, given a 25% whole person impairment if it occurs in the cervical spine. If it occurs in both cervical and lumbar, it equals a whopping 40% whole person impairment. Now, the vertebrae can move in different directions, so this shows angular motion. So now, this cannot be determined by human eye, by hand drawing on vertebrae. It must be sent out and referred for diagnostic radiographic mensuration using special software. Here's just another little example. Okay, now we have put together plaintiff's exhibits, and I'm going to demonstrate them for you right now. The first set of exhibits are designed, and then the second set are more legal admissible format, but let's just go over it because the exhibit is going to contain what's needed to overcome disputes among varying opinions, like from the insurance adjuster or a supervisor, in-house counsel, or IME doctor. This exhibit contains statements of undisputed facts, memorandum of points, declarations, exhibits, and authorities. Now we're going to route you to a website that will also show you some juror case awards, and we are going to also make sure you get a copy of the book. All right, let's go. Now, in this presentation, the animation does not work, but when the attorneys are in receipt of this, the animation will work. The arrow is on the vertebrae. It will show that vertebrae, how it moves when the ligament is torn. It will show how it damages the cervical chain ganglia and the disc involvement. So let's read from the top. AOMSI is a medical condition. Excuse me. It is a medical condition that occurs when G-forces are sufficient to tear the main supporting ligaments in the spine by 3.5 millimeters, resulting in permanent instability of the spine. G-forces. The G-force required is only 8.2 miles per hour. That also is not enough to cause property damage to the vehicle. All the research was done on low speeds. It did not produce vehicular damage. And the research says 65% of everyone in a low-speed collision has this. The next paragraph tells us that these torn spinal ligaments are significant for the AMA to rate as a 25% whole person impairment. AOMSI has the same whole person impairment rating as an amputation of a foot, considered as severe as 2 vertebrae requiring spinal surgical confusion. So the animation is a key to this thing, and it will work when we send the electronic version to the attorneys. It actually shows the dislocation of the vertebrae involved, the resultant instability of the spine, the dislocation of the vertebrae is seen further pressing against the delicate nerve bundles referred to as chain ganglia, which are located right next to the vertebrae, and its involvement with the disc. And again, there's the AMA guide quote. It is an objective medical finding based on mathematical modeling, has nothing to do with opinion. So the attorney wants to convey that the client has tested positive for one of the highest rated spinal injury types and as recognized by strict criteria of the AMA guides for the diagnosis of this injury referred to as alteration of motion segment integrity. Now, to meet the burdens of proof or the evidentiary burdens of proof and evidence-based practice and best practice, the injury diagnoses can be referred for the process of independent medical validation, which is what all of our doctors are doing. That's an independent third medical party that will put a stamp on this according to 72 court authorities, administrative and judicial decisions, rulings, and opinions, and hearings. That red stamp gives you the preponderance of the evidence. It will preponderate over others. It will show that you have greater believability, and it will win the greater weight arguments. You cannot refute the presence of this injury once that stamp has been done by independent medical validation, unless you can show that the injury is so against the great weight that it is manifestly unjust. And that can't happen because of all of the data that is presented, which by court authority wins the greater weight. So to meet burdens of proof, most of the time, or you have an option to send this out for independent medical validation to get that stamp. It will override the independent medical examination, override any adjusters' opinions or supervisors or other attorneys on record. So that's an excellent tool. Have this independently validated to show its presence and its existence and establish its veracity as a key element in assuring that evidence-based data has been met for validating medical principles and their determinations and their goals, to establish the preponderance, to eliminate varying medical opinions, and to show there is great weight of the evidence and you've got it. Now, the attorney can present the AMA criteria to accurately diagnose this injury, as some people may not understand all about it, including adjusters. Torn ligaments in the spine cause alteration of motion segment integrity, and it is only induced by trauma. And it is a macro trauma. It occurs instantaneously. The diagnostic test of using computers to prove torn, damaged ligaments is referred to as diagnostic radiographic mensuration analysis, and it really hasn't been available until just a few years ago. It wasn't available in the third edition AMA guides. So we want to represent the individual factors that form the basis of the diagnoses that represent this injury severity type. It is an injury threshold. And we want to show it's been documented by the physician and presented as evidence. So the attorney will be able to submit evidence-based data to establish the burden of proof, to fulfill his or her obligation to establish by evidence a requisite degree of belief concerning a fact in the mind of the trier of the fact or in the mind of the court. Now, if this medical evidence comes under dispute by independent medical validation and by court authority, one must raise such a reasonable doubt concerning the non-existence of a fact by a preponderance of the evidence, by clear and convincing proof beyond a reasonable doubt. So the attorneys can now challenge the defense to produce another doctor who can show that the findings are so against the great weight that they're clearly wrong and manifestly unjust, but no longer by the IME opinion. Rather, the process of independent medical validation, or IMV, because that follows precedents and authority set by previous court rulings, judicial decisions, and administrative legal findings rulings to establish the preponderance of the evidence and to show that our side outweighs, preponderates over, and has more evidence than the other side. If this should proceed to civil trial, it's not necessarily done by number of witness or quantity, but in its effect on those to whom it is addressed. Now, one of the purposes is to produce enough evidence-based data by one side to create a belief that the existence of a fact is more probable than its non-existence, and that its version is more likely true than not. If such evidence-based data comes under dispute, again, that dispute must show that the finding is so against the great weight and preponderance of the evidence that is clearly wrong and manifestly unjust. And that cannot happen because we're following authorities. Now, the quality system of regulation defines this medical validation process as establishing by objective evidence that a medical process consistently produces a result or an end product meeting its predetermined specifications, stating how the validation will be conducted, including the evaluation parameters and what constitutes acceptable test results. Now, courts of law have provided legal precedent stating the impairment report of a designated doctor shall have the presumptive weight or the great weight, and the impairment rating will be based on that report unless the preponderance of the other medical evidence is to the contrary. So, the AMA guide states that AOMSI is a macro trauma occurring instantaneously and a rare occurrence without severe trauma. It is not a degenerative condition, nor does it develop with age or wear and tear. And the AMA guides further state the evaluator who more closely follows the AMA guides will be the evaluator whose opinion is accepted as choice. And if the preponderance of the medical evidence contradicts the impairment rating contained in the report, another doctor can then be called upon to dispute according to the AMA guides. Now, we are submitting a table format. That is another vodcast, but table formatting is the format that is admissible and accepted, and it will be accepted by the insurers as well. So the courts have defined the preponderance as evidence that has greater weight or is more convincing in comparison to the evidence introduced by the defendant. It says the majority of the evidence will favor one side or the other as described by other courts and authorities. And it says enough evidence has been produced by one side to create a belief that its version is more likely true than not. And they define substantial evidence as more than a mere scintilla, or such relevant evidence that a reasonable mind might accept as adequate to support a conclusion. Further, there have been boards that will not interfere with the credibility determinations unless they are inherently incredible or patently unreasonable. We've got the greater weight of the evidence. Now, if you don't like to use exhibits with diagrams or design, this is the same wording in a more admissible format. Okay, so we provide the animation, the exhibit in design format, and in this format, we provide the language. The AMA Guides, 5th edition, Chapter 15, Table 15-3A, B, and C, depending upon the area of the spine, page 378 to 379, says that diagnostic radiographic mensuration analysis is required to establish the burden of proof of admissible evidence to demonstrate the existence of this injury and the degree of impairment. So we will provide you all of the AMA guides so that you can show which guide edition, chapter, table, and page. And then they would have to refute that is against the greater weight. Now, we also have images that come from the software. And the red line denotes the permanent impairment. Green line shows normal alignment. Blue line shows areas that are significantly clinical but not rateable. When we have an injury that's rateable, it means you have used this model, this software, it has exceeded 3.5 millimeters and creates the instability. So this is also part of your evidence. And it's very hard to find this rateable injury by naked eye, which is why in order to have it rateable and in order to establish its existence, you have to use this mensuration analysis software. There is a website for attorneys called overlookedinjury.com. It's a guide for the plaintiff's representatives in representing this injury. Overlookedinjury.com will explain to attorneys about this injury. Overlookedinjury.com will also show court cases and juror awards. Overlookedinjury.com will also have information about other injury thresholds. The site the company that we refer to for people to have their x-rays analyzed is called DRMA Pro, drmapro.com. It stands for Diagnostic Radiographic Mensuration Analysis, DRMA, Diagnostic Radiographic Mensuration Analysis Pro. That's where the physicians go to send their x-rays to the lab because this equipment and the software is not a normal part of a doctor's office or an MRI center. Now, there is the truth about auto accidents, and I like to say the truth is like a lion. You don't have to defend it. Let it loose. It'll defend itself. That's what we're here for. We're here to present evidence-based data, and we're here to present education presentation to attorneys so they can take this data, include the language in their demand, and use our exhibits on these injuries so that they can thoroughly represent them and show that we preponderate over the others, we have greater believability, and we win the greater weight. Our feature website is called accidentworks.com, where both patients and physicians and attorneys can learn an awful lot if they've been involved in an accident as a patient, if they are representing it as a physician, or if they are documenting injuries, and if they are representing it as an attorney. We have a portal for all three at accidentworks.com. My phone number is listed at the bottom. I am Dr. Frank Liberty. The number is 727-520-3961. And I am going to make myself available. So I try to do several vodcasts a week. I usually do one that's an hour, one that's about 20 minutes, which is this one. And then I do a bunch of 2-minute vodcasts. I have a YouTube channel if you get a hold of me. Most of the time I'm talking about threshold injuries for physicians, but we always want, for example, in our book, I mentioned the table formatting. That's what table formatting looks like. In our book, I mentioned that we have the language with the statements of undisputed facts, the memorandum of points, the declaration of the authorities, and we want to find a way to educate attorneys about anatomical injury sites in a non-inflammatory posture so that they will understand this. You can go to accidentworksofamerica.com for tons of information, and you can contact one of our members for a copy of the book, which I'm sure is going to be extremely helpful to you. And here's my last closing statement. Many attorneys have undervalued claims. And I'm going to go out on a limb and say we know 65% of those people, but up to 82% of those people actually have the AOMSI $60,000 injury when the claim's been undervalued and no one's discovered the injury. So contact one of our doctors. They can simply look at an x-ray and immediately determine if the injury exists, in which case you get to present a new demand using our language, our exhibits to help you to understand it and then to represent it and change the undervaluation when there had been no other factors to be utilized to help enhance the value. You've got way more than half of your clients that are undervalued with the injury. And so it'd be a good idea to understand more about this injury. And you're welcome to contact any of our members at Accident Works. There's a physician directory, and they'll come over. They can present you a CLE course where you can get a credit. They can give you the book, show you the presentation, get you the language, and help you to understand that injury. And then they can help you detect which of your clients have it, and if you have future clients, how to determine who's a candidate. We don't want to overlook this injury. It's not only is it bad for the health of the injured party, but it's bad for the claim. And so we're here to educate and present. Our motto is to educate attorneys and not sell them. We're not here for that. We're here to help diagnose the threshold injuries, which many people overlook. We are here to present complex data so that it can exchange value, interface, and input that added valuation. For example, if you have a client that's got the injury and you don't represent it or document it, it's lost, and we don't want to see that happen. All right, I think you understand the program. I'm Dr. Liberty. That's it for this podcast. See you on another edition, and thank you very much for being here.